My name is Lopata, and I'm pleased to present Embrace Women's Health. Embrace Women's Health is an obstetrics and gynecology practice located in Armadale. Our task was to create a sustainable and high-quality healthcare facility that promotes wellness and patient experience while respecting and preserving the historical value of the existing building. Embrace Women's Health is located on a corner site wedged between Wattle Tree Road and Dandenong Road, and it's actually on a corner site of Gladstone Avenue. It's ideally positioned within 1 kilometre from Cabrini Hospital and very close to various community hubs such as Malvern Central. We were presented with a site that was in a bit of dilapidation. There was a large magnolia tree that was overgrown. The roots were beginning to damage the building. On the south, there were large spoon drains around a paved area that sort of was affecting reasonable accessibility. And in between, there were narrow paths leading around the building and to the building, and the interior had dark spaces. Our solution was to firstly start off by removing the tree, and it was after great consultation that we did that, but in the end, that act was actually stopped the damage, and it allowed a lot more light back into those northern rooms. We proposed on-grade patient entry to the rear via new paths and ramps, and this was done without much intervention to the existing building. We introduced additional street access via additional pedestrian gates and proposed a centrally located architectural intervention, the intent of which was to introduce additional light and air without the need to radically increase the overall footprint. And so some photos of what that was like. Okay, so there are 5 main zones within the building. This is showing the existing. And for us, this was really important to try to achieve the program brief within this envelope. The idea was to, one, preserve the existing heritage edifice of the building, but also to preserve the embodied carbon that building was holding, or at least what was demolished to reuse it and knit it back into the building where possible. There's a patient zone. These areas all eliminated all the internal steps in the building, so we lifted the floor towards the rear to match it in with the corridors. And within this patient zone, there's a quiet space, a place for feeding parents with special amenities, a place to break away from the main area but be still visible from reception. And we have our consulting zone, which is our doctors and other health professionals. A treatment zone, staff administration zone, and finally a mixed use zone, which is currently used for Pilates. This is the front facade. The extent of our intervention from this side of the building was the restoration of the facades and roof. Outside to the left, we introduced some custom bicycle parking, and to the right, a large new path that leads patients to the new entry located at the rear, and some greening to the roof. From this angle, we see the roof form, which acts to bring light and draw air into the central parts of the building. The most north roof plane is designed to integrate the solar panels, and the materials were selected for longevity, low maintenance, and neutral tones, similar to the existing materials. We lowered the fence line to assist with wayfinding, safety, and engagement with the streetscape. So this is sections and elevations. So the new roof and facade elements replicate some of the existing roof forms. We carefully considered deep sculptural ceilings, provide voids to house mechanical services, and support high clear story windows to catch and reflect the natural light. A key aspect of this project was a focus on retention of the existing building footprint and insertion of a contemporary build form within the Victorian era building. This project aims to make a clear delineation between old and new, presenting the new as if emerging out from and breaking through the old. The series of new roof configurations penetrate the existing roof line, but the bulk of the new remains nestled inside the original building. So the sculptural eaves here forms a shadow it shadows the part of the original hip roof now removed. The tall south-facing windows assist to bring diffuse light to the interior all year round, with window frames similar to traditional greenhouse or garden rooms of the 19th century. Our aim was to create a contemporary version of the Victorian garden room as the initial patient entry experience. With this, our philosophy was to promote wellness through the use of biophilic materials, air-purifying plants, provide acoustic comfort, a sense of enclosure within a tall volume, and introduce a system for clean airflow. This is the garden room concept detail with integrated planter boxes to house the selected air purifying plants and to be surrounded by warm textural tones. The reception emphasises the sculptural forms of the volume around it. A massage room contained within the garden room waiting area context has a greenhouse type ceiling for natural light, with walls constructed from reclaimed bricks from the site, reclaimed bricks that were also used for the wall hobs elsewhere. And this is a view down to the quiet space, soft, comfortable, secluded and practical. View back to the waiting area that has made the most of a very small space. And the elegance of the old building retained. We've used copper here as a means to introduce everlasting natural antimicrobial material, especially noticeable at the touchpoints. The rooms located in the existing building now converted into warm and elegant health spaces in keeping with the splendour of the old building. Embrace Women's Health aims to create a high quality, sustainable and accessible health care practice that respects and preserves the historical value of the existing building while promoting wellness and patient experience.